Welcome to my channel Vital Energy. I'm a veterinarian trained in Western medicine and also in traditional Chinese medicine. And my goal is to take you with me and go on a journey through traditional Chinese medicine. Our topic today is, when I put a foot into a clinic of a traditional Chinese medicine practitioner, what should I expect? Is there something voodoo going on with that needles sticking into bodies and stuff like that? Or is it legitimate medicine? Is there even science behind it? Let's talk about that. Come on in. First of all, you have to notice Chinese medicine is ancient. And that's what I mean by it. It's really that old. It's ancient. It's over 2,000 years old. There even is writing on turtle shells that are over 6,000 years old, where we can find writings that's wrapped around medical stuff, like people writing about parasites or herbal tinctures and stuff like that. Clearly, traditional Chinese medicine wasn't as developed as it nowadays is. It developed over time, and so we have this complex medicine and this huge amount of knowledge. Back then, 2,000 years ago, doesn't matter when, but in ancient times, there wasn't stuff like blood work or x-rays or ultrasound. There simply wasn't the technology available. So what did the traditional Chinese medicine practitioner do back then to find out what was wrong within their patients? Simple. They used their senses, and we have a lot of them. We have our eyes, we have our nose, we have our ears, we have our fingers. Don't be mistaken, also the Western medicine practitioners, they use their senses as well. But sometimes they can't differentiate with, for example, their hands, their findings, as well as traditional Chinese medicine practitioners. But let's go through all those senses so that I can show you what I mean by using those senses to get to your final diagnosis. So let's start with our eyes. Our eyes are very important. As your patient comes in, you look at it and you figure out, how is the pet moving? How is the fur? Are there some cracks in the paws? Are there flakes that could show you some signs of dryness of the patient? It is also very important to look at the tongue, because you want to know which color it is and if it is wet or not, and if there is some sticky fluid, phlegm going on your tongue. Maybe now you're thinking, looking at the tongue, isn't that odd? But let me assure you, also Western medicine takes the tongue as a diagnostic tool, because they also want to know which color the tongue is. For example, if it is a little bit on the pale side, maybe there is anemia going on. So maybe we had blood loss or something like that. And also, if we think about animals that have problems with saturation of the blood with oxygen, then we will expect to have a slightly bluish tongue. Now you know, also the tongue as a diagnostic tool is very important for Chinese medicine, but also for Western medicine. So nothing odd. Next, we smell. Also in Western medicine you smell. So you see, Western medicine and traditional Chinese medicine oftentimes is very close to each other in regards of examination. But back to our senses then. Next we have our ears. For example, you could hear if your patient is coughing, and then you would like to know, what kind of coughing is it? Is it dry, or can you hear some moisture going on the lung? Or is it weak or explosive? Well, that's all kinds of stuff you can register with your ears, and therefore they are very important. Next up, we have our hands, and that's the most useful tools for a traditional Chinese medicine practitioner. I can show you just in a sec. But first of all, you have to know that our body works in a certain way. Within our body, we have these organs, and these organs are managed by the brain. So we have the brain, then we have a nervous system running down our spine and then goes to the organ. Now our brain is able to tell our organs when to work, how to work, and so on. But if our organs aren't functioning as they should be, for example, there is some inflammation going on the liver. Let's take that. Then we have something maybe painful going on the liver. But how do we even know that it is painful? If we have this connection from the brain down to the liver, we also have it from the organ up to the brain. It means if we have an inflammation going on the liver, an impulse runs through the nerve up the spine and to the brain. And within the brain itself, there you could register there is really pain going on down there in the belly. What I wanted to emphasize here is we have this organ, this connection, and the brain. And we can make use of this connection, this nervous connection. We could touch some areas where we know that this nerve would run through. And if you touch that area and you get some kind of sensation, then you know, well, there is something going on there. Maybe on the nerve, maybe on the organ itself. And what do I mean with sensation? Well, sensation is kind of when your patient is moving away from you when you're touching some points, or if it even gets angry and tries to bite you, then you have a really strong sensitivity there, and you know, well, there definitely has to be something wrong. For palpation, first of all, you're getting your hands on your patient, and then you want to know, oh, what's the general temperature of your patient? Are there some spots where your patient feels cold to the touch? Or is it really hot, your pet? What's going on? And furthermore, you want to palpate your blood vessels on the hind limb so that you can find out what the quality of your pulse is. That's nothing new. You have to imagine in Western medicine you also do some similar stuff. If a vet is trying to find out if a cow is pregnant, well, it has to be in a specific period of pregnancy. But if your vet is trying to find out if the cow is pregnant, then he will try to palpate some blood vessels within the cow, especially blood vessels that lead to the uterine. And if they are some kind of vibrating, then the vet knows, well, there has to be something in that uterine, and that something, a calf, has to be alive. Now you know that the palpation of blood vessels and specifically the consistency of a pulse is a very useful tool for either Western medicine but also for Chinese medicine. To sum it up, your hands are an incredibly valuable tool for assessing your patient, helping you gather important information even before using blood tests or other technologies. Isn't that great? But it is also very important to emphasize modern diagnostic tools such as ultrasound, X-ray and blood work are invaluable. It's beneficial to share these results with your traditional Chinese medicine practitioner so that he can use this information to further develop his treatment plan. And now, as we talked through the examination process, maybe the question raised, well, but how does the traditional Chinese medicine practitioner actually diagnose his patients? It's kind of different than from Western medicine aspects, because Western medicine, it likes to look at a patient as you have a problem, so you get some symptoms. Well, let's take an example. We have a pneumonia and therefore we have coughing. And as a traditional Chinese practitioner, you focus on your patient. You want to know where are factors that are influencing your patient so that he gets pneumonia. You see, you don't focus on the pneumonia that is leading to coughing. You look at the factors which are influencing your patient so that it gets ill. That's a whole other perspective, and it's very important. So I'll take you back to the examination process. What I left out was that before you examine your patient, you would ask a lot of questions. Western medicine would do the same, but in traditional Chinese medicine, you would ask some more questions. Some things like, well, where do you have, for example, your dog? Does it stay outside in a hut? And maybe there is some wind going on, and maybe therefore we have our lung issue. Or stuff like emotional state. I know it sounds a little bit like voodoo stuff, but it really isn't. Just imagine, did you ever hear from a couple of bunnies where one of the bunnies died and the other one just shortly after? Also in human medicine, if we have an old couple and unfortunately one of them dies, then the other one suddenly gets a heart attack shortly after. Why is that? There you can see our emotional state strongly is correlated to our health. So our traditional Chinese medicine practitioner, he really wants to know how is the emotional state of the patient. But questions aside, I bet you really want to know how your practitioner now goes ahead and diagnoses your patient or your animal. Well, he takes all this information he gathered together. He'll take the responses of the questions he asked and overall everything from the examination he just did. Then he would go ahead and figure out what is wrong within my patient. Is there an imbalance? I know, imbalance is a very strange word, but what it does is it explains the correlation between what's wrong and what's normal state of the body. And if I have this imbalance, then all I have to do is reverse it so that the body is getting to his normal state. And therefore, normal state means, well, health. When we go back to our example, then pneumonia and therefore coughing, early on I talked a little bit about coughing itself, and now it's getting very important because if we take our coughing, we wanted to know, is it weak? Is it dry? When does it take place? Just for the example's sake, we have a dry, weak coughing. Then in traditional Chinese medicine, maybe you could call it lung yin deficiency. Well, that really sounds weird, right? But it isn't. When you translate it into normal English, it means the lung is too dry. Or the lung lacks of moisture. Okay, what do we do with that? In traditional Chinese medicine, this condition may be interpreted as lack of moisture in the lungs, and the aim would be to support the body's ability to regain normal state. Well, then if we want to go back to the normal state, we have to give the lung some moisture. Simple. And that leads us to the next chapter. How does a practitioner treat his patients? Well, we have 4 pillars. They are acupuncture, herbal medicine, Tui-Na, that is massage techniques, and we have our food therapy. Don't be afraid, you don't have to introduce all of them for your patient. Sometimes it's enough to use just one technique, for example, acupuncture, or you could combine it with another technique like herbal medicine, so acupuncture plus herbal medicine treatment. But you have to know, as you take more and more of these techniques together, then your treatment gets more and more efficient and you get to your goals more quickly. I'm sure you really want to know now how acupuncture actually works. But unfortunately, it is a very, very, very big topic. So if you want to know more about it, please comment down below and even leave some questions so I can design further videos especially designed for you. That you don't miss the new video perfectly designed for you, please subscribe. Then you will be noticed as soon as I upload the new video. But let's jump back to our treatment plan. Well, as we said, we have our acupuncture. Therefore, we would use acupuncture points that are specifically supporting the lung and also generate some moisture or supporting the body, generating moisture for the lung. And that could be combined with herbs that also follow the strategy of supporting the lung and the body generating moisture. And then we have our foods. And just let's talk a little bit about food right now, because you have to notice that food is highly impacting our body. For sure, you already have eaten some black pepper or chilies. They are very hot. And what you would have noticed was maybe you suddenly get hot or got a red head or you even were beginning to sweat. Well, that for sure tells us that food highly impacts our body on a daily basis. And if in our case of the lung lacking moisture, we would leave out some food ingredients that are drying out the body, and also if we would introduce foods that are high in moisture and are helping the body to pick up some moisture, then it would also help with our disease, the dry lung. Now you know how a traditional Chinese medicine practitioner would go ahead and treat his patients. But you almost certainly heard things like, well, but Chinese medicine, well, you have to believe in it, or, well, it's placebo effect, or, well, it's not even medicine, you just have to believe in it, there is not even science behind that medicine. You'd rather should go to Western medicine, it is science-based and we know all about it. These assumptions are understandable, but they don't fully reflect the current research, which increasingly shows measurable effects of acupuncture in animals. There are numerous studies exploring the effects of herbal ingredients and acupuncture, including their impact on hormones and neurotransmitters. However, it's important to note that research is still evolving and not all mechanisms are fully understood. But that's also true for Western medicine. Let's take neoplasia. Neoplasia is a very big topic as well, and we dare not to say that we know everything about it. In some cases, determining the most effective therapy for neoplasia remains challenging. Some studies suggest that acupuncture may be equally effective as conventional treatments in certain conditions, though more research is needed. But what we know is that both kinds of medicine are highly valuable, and why not take the best things of Western medicine and the best thing of traditional Chinese medicine and combine it for our patients? It doesn't matter what it is, Western or traditional Chinese medicine. We just want the best things combined so that we can help our patients better, right? And with that being said, that's all I had to say today. But before you go, I have something very important to say. If you have an animal at home that is suffering from a disease, please don't just rely on these kind of videos, because they are just for educational reasons. And take your animal to your vet so that a professional could look at your animal and diagnose it. Therefore, you would end up with a treatment plan that is specifically designed for your animal, and so that your animal would get better help. And with that being said, I thank you so much for tuning in, for being interested in this huge topic, traditional Chinese medicine, and I will be excited to have you back with new topics. Well, have a good one. Bye.